Good evening. My name is Sarah Testa, and I will be presenting the strategic audit for the Stowe Urgent and Primary Care Center. Stowe Urgent and Primary Care Center is a satellite location for Western Reserve Hospital. Western Reserve is a physician-owned and operated community hospital located in Cuyahoga Falls, Ohio. The mission and philosophy of the organization is to deliver 100% patient-centered care. The organization is extremely involved within the community, collaborating with other businesses and schools in the surrounding areas. The hospital's main campus and the satellite location employs almost 800 employees, which include more than 400 physicians and 200 nurses. Western Reserve Hospital uses a hierarchy organizational structure. Although there is a larger and more detailed organizational structure for the hospital, I'll focus on the areas that are relevant for the Stowe Urgent and Primary Care. On this slide, those are in green. At the top of the structure is the president and CEO of the hospital. The next line of professionals are the top management or executive team of the hospital. This includes the vice president of ancillary services. She works directly under the president. She is who the director and manager of the clinic report to. The registration staff, medical assistants, LPNs, and rad techs report to the manager of the facility. The Stowe Urgent and Primary Care is located in Stowe, Ohio. It offers 5 services in one facility: an urgent care, primary care, occupational medicine, employee health, and workers' compensation claims. This is a for-profit organization that has done very well financially over the past few years. The organization is led by the board of directors, which is comprised of 8 physicians and 1 community member. The top managers or executives are responsible for the majority of the research, analyzing, and planning for the objectives and strategies throughout the hospital. However, the board of directors is very involved in the strategic management process. Understanding the internal and external environment of the organization is a key factor in any strategic process. Working with the director of the Stowe Urgent and Primary Care, I was able to identify major strengths, weaknesses, opportunities, and threats for the clinic. The key strengths for the organization is its level of community involvement and marketing. Not only does this ensure a high patient volume, but having a strong presence in the community ensures a stable revenue source for years to come. The major weakness identified for the organization is employee morale and overall employee retention. Improving the employee morale will increase the employee retention rates. The greatest opportunities that have been identified are referrals within the organization and technology advancements. Both of these opportunities provide the Stowe Urgent and Primary Care with avenues to continue to build patient volumes and increase revenue, while strengthening their presence within the community. The greatest threats identified for the clinic are threats of new entrants into the community, as well as ending a recent partnership with another well-known organization. After completing the SWOT analysis for the organization, strategic alternatives have been explored. The first suggestion is focused on information technology by implementing a new electronic medical record system. A great opportunity identified for the organization was the referrals within the clinic. Taking a marketing developed approach by creating a system to increase these organizational referrals is the second alternative. And lastly, to focus on a major weakness of employee morale and retention, an alternative strategy is to focus on human resource management by developing an employee recognition system. After much consideration, it is my recommendation that the Stowe Urgent and Primary Care should implement a new electronic medical record system. Specifically, the clinic should adapt the EMR system that the main campus is already using. Using the same EMR system will increase the communication and patient care and can aid in increasing the referrals at the clinic and has the potential to increase employee morale and retention. While it is expected that this will be a lengthy and costly endeavor, it offers the greatest opportunity for the clinic. The implementation of the strategic plan will follow a timeline of 4 phases. Phase 1 is the preparation phase and should be completed in 90 to 150 days. During this time, a specialized team will be developed to oversee the financial planning, system selection, and overall implementation of the new system. This is a crucial stage that will involve executive level employees. Phase 2 is the research phase and should be completed in 60 to 120 days. During this time period, the team will conduct research comparing costs and training strategies available. Although it's anticipated that the urgent care and primary care will adapt the main hospital's EMR for convenience of the staff and patients, during Phase 2, this provides an opportunity to thoroughly examine other available EMRs and compare price and ease of training. Phase 3 is the implementation phase and should be completed in 45 to 180 days. During this time, a system support team will be developed, mass training for all employees of the organization will begin, and finally implementing the go live for the new system. This is a very time-sensitive phase. All staff and users must complete training prior to the go live, or the go live will be a disaster. The implementation of a new EMR is lengthy and challenging and will require ongoing training. However, ensuring all are prepared for the go live is the most important to ensure patient care is not affected. The final phase, Phase 4, is the post-implementation phase. This should last about 6 to 12 months. During this time, the team will evaluate the system and make any additional modifications if necessary to ensure the organization is working as effectively and efficiently as possible. Evaluation and control is an ongoing process to ensure that the application is meeting the strategic objectives. The post-implementation evaluations should be completed quarterly. The support team that was formed before implementing the new EMR will oversee the evaluations and make any necessary modifications or offer additional training where necessary. Random chart reviews will be conducted to ensure quality control. This is essential in ensuring the EMR was successfully implemented to prevent any medical record errors. This slide offers an example of a balanced scorecard that can be used to evaluate and control post-implementation. The scorecard lists the objectives identified prior to the implementation and records the quarterly evaluations. Utilizing the color coding systems allows for an easy to follow and understanding of the visual and the process post-implementation. I thank you for watching, and I'd be happy to answer any questions at this time.
Hi, this is Katrina. I have a question. Why wouldn't they implement the electronic medical record system when the main campus got it, seeing that they're probably interchanging patients or patients that are being seen at that campus might be referred to the main campus? How come that wasn't included, with the main campus?
That's a very good question. The Stowe Urgent and Primary Care was actually a different group. It was a different organization prior to Western Reserve Hospital acquiring it. So it was a completely separate entity, and there is actually, I don't know why they wouldn't have done it at that time, probably due to the budget and finances, because that's a pretty costly endeavor to do while you're trying to acquire a whole nother organization as well.
All right, thank you so much.
Okay, if there aren't any more questions, I will hand it over to Jessica.
Hello, my name is Jessica Hedger, and this is my strategic audit. My interview was with Teresa Cole, who is an HR manager at a facility in Vandalia called Crossroads Rehabilitation and Nursing. This is a nursing home facility. When I did my external environment with her, one thing was found was socioculture. The social media and conversation make or break businesses or facilities. You can either be promoted with positive comments, or if people don't like the experiences, that can hurt you as well. People are more educated than ever about their care, and they want to share with their family and friends where to go and where not to go. Another external would be competition. All nursing homes want people to choose them for their care. So they compete to provide the best care to the residents and have clean facilities, so you want to refer more people. The internal environment, the structure, they have a decentralized unit, so each of their little units for the facility makes up their own goals and pretty much runs the daily activities. The senior staff makes the decisions, and then each unit is ran, like I said, as needed. The management of the structure is backed up with SOPs. Explanations are at orientation. They have a good amount of meetings to educate everybody, which allows for open communication so that all employees feel somewhat included. Also in the internal environment, there is marketing, which they use Facebook a little bit. They have a corporate website. They use Indeed for jobs, and then the corporate website describes the facility and what their main focus is. The financial aspect, they follow a budget. By following a budget, this allows the facility to see where they're succeeding at and what areas need to be cut back. The HR department is ahead of all hiring processes. They're very selective of who they hire because that sets the tone for the whole environment. The strategic factors, some of the strengths that I seen was the sociocultural. The patient care is the main focus, which in many facilities now, that's not the case. A lot of places are worried about the money or the insurance reimbursements. So this place at least tries to still focus on the patients. All the employees have the same focus, and culture is consistent. This is important so that you guys, all the employees, are working towards the same goals, and everybody's aware of what they need to achieve. They have a no tolerance policy, which is good because this allows employees to know that they can't get away with anything they want, and they are an equal opportunity employer. The weaknesses, I use sociocultural on the strengths, weaknesses, and then on my next slide, because if it's positive comments, it can help you, or if it's negative, it can hurt you. So it actually falls in each different category. Another weakness is the decentralized structure. That kind of can hurt the facility by having everybody not work together in some ways. And the goals and functions being decided by senior staff, that can start making employees mad because they're the ones who do the daily task, and they can know better what goals should be set, what things need to be improved. And if you're only being told by higher ups what to do, you can start getting a little irritated. Some opportunities, like I said, the sociocultural, and HR handles all the hiring, orientations, and benefits, which is nice because they're consistent with what they're looking for. And if you split up the hiring or different orientations with different people, you might mix up what you're looking for. A threat, sociocultural, the external competition, which is never going to go away. Different facilities are always going to compete with each other. The decentralized structure, if that's not corrected, employees could get mad, and then you could have people leaving. And like I said, the goals and the functions being decided, that again could make people leave. Some of my alternatives was to strengthen the social media I know they already have their Facebook, but just to promote their business more, make people more aware of where they're located, what they stand for. Eliminate the decentralized structure. Senior staff has to incorporate all their employees and have monthly meetings. This allows employees to be involved more. The units improve patient care. We always want the patients to be the main focus and get the best care possible. And then the daily goals they're having right now, that'd be good to continue. And then develop all new SOPs and actually have the employees lead those different groups, because then they feel involved and they're gaining more experience for anything they would like to do down the road. Implementation, employee involvement with the goals. This is where they see the daily activities and know what should be focused on, where they lack, and I think more would be completed if they were the one to set the daily goals. And then, like I said, the SOPs could be ran by the employees or any other small program that people get tired of doing the same daily things. So if they could branch out a little bit and do little monthly programs, that would keep them more interested. And then for my evaluation and control, they actually currently have a benchmark system and adequate controls. So if they would maintain that, I think that's a great way to make sure things are working. And for employees, when they have their reviews, which they have them 4 times a year, they have a benchmark, and if each employee meets everything on that benchmark, then they get a certain % of a raise. If they don't meet everything, then they just get a yearly raise. So I think that's good for all the employees, to encourage them to keep trying their best and to reward them for all their hard work. And that's the end. Does anybody have any questions?
Very nice presentation, Jessica. This is Sarah. You mentioned that social media can make or break the business. Can you give an example of how social media is used for this organization other than the Facebook that you mentioned?
When I interviewed Teresa, she explained just mainly the Facebook and the Indeed, and I think they have a LinkedIn maybe too. So different things like that get the news spread. For Facebook, I know they are involved in their community a little bit, so they'll have like different programs going on to bring in the community, which advertises for them. And then like for Halloween and stuff, they have different trick-or-treat things just to include everybody and get them in. And then when people need that kind of care, they remember back to those moments and think about looking into that place to send their loved ones.
Great, thank you very much.
If that's all the questions, I'm gonna turn it over.
Okay, my name is Leisha Clevenger, and I did my strategic audit project on Dublin Methodist Hospital. Dublin Methodist Hospital is a hospital here in Dublin, Ohio. It is currently 9 years old, has 114 beds for inpatients, over 500 associates, and it is ranked in the top 5% of hospitals in the nation. They have also received the Most Wired Award from Ohio Health. Dublin Methodist is a part of the Ohio Health Organization, and they are the farthest along in technology out of all the other hospitals. They are big on trying to be paperless, and all of the employees communicate with a phone, like a little phone that they wear around their neck the whole time. And the way that they keep track of all their patients in beds is all on an electronic system that communicates with all the other Ohio Health hospitals. And it's just really amazing, some of the items that they have there. Some of the external environments, items that affect the hospital is kind of the season. And for example, is flu season. During that time, as you can see on my graph there, the number of patients that come into the hospital and that are sick goes up tremendously. During that time, there is times of code expedite. That's where all of our beds are full and we cannot take any more patients because of everybody being sick during that prime time of everybody getting sick. So you just have to be able to prepare for those items. Another external environment item that affects the hospital is the health insurance. There are certain ways that you have to code everything and bill things to the insurance companies in order to get reimbursement. And sometimes if there's just one item that's off, the hospital doesn't get that reimbursement and then they're going to lose money. And it's the same thing with Medicare. They have certain stipulations on, for example, when you have a family physician, Medicare patients have to go in and see them so many times a year. And if they do not have those checkups and things like that, then the doctor's office gets a fine. And so making sure that the hospital stays up to code and date with all of the stipulations that Medicare requires is very important to make sure that they get the reimbursement that they need. And also kind of not knowing what's going on with the Affordable Care Act right now, and just like the other types of insurance, making sure that they stay within regulations for the reimbursement from the Affordable Care Act. A threat is other healthcare organizations. Dublin is real close with in Columbus and everything, and so there are a bunch of hospitals, freestanding emergency rooms, outpatient facilities that compete with Dublin Methodist. A huge help to the hospital is the community. There are a lot of people around there that volunteer at the hospital and that think highly of the hospital and make that the only place that they go to for their care. And the hospital is also involved in a lot of fundraising activities to help promote them. They have races that they, like running races that they raise money for the community and things like that. The current situation, they are, like I said, a part of the large organization Ohio Health. It was built brand new from the ground up in 2008, and it was the first hospital to be built within Ohio Health from the ground up in 25 years. So that was a huge step. It's a big expense to build a hospital from the ground up, and that's what they did. When interviewing the manager that works at Dublin Methodist, she said that it was nicknamed Club Dub because of the high quality and the beautiful building that it built and everything. And a huge part of it being nicknamed that is every room is a single patient room. They're not even equipped to have two patients in there. And when you're sick and in the hospital or having a baby or anything like that, the last thing you want to do is share a room with somebody. And as I stated earlier on a previous slide, they are ranked within the top 5 hospitals in the nation. And in Ohio, there are only 10 hospitals that fall in that top 5%. And one reason that Dublin Methodist was built and is doing so well is because of the population growth in Dublin. It is one of the highest growing areas in central Ohio, and in 2000 there was only about 32,000 people that were in Dublin, and already in 2010 it jumped up to almost 40,000, and currently in 2017 there's 44,000 people in Dublin that this hospital service. The hospital, just a couple of things that they offer are outpatient services for radiology, pulmonology, some cardiac procedures. They offer outpatient surgery, and then they do have a full running emergency room. And for the inpatient, I made a typo there. There is actually 114 beds there, and they offer different ortho doctors, general surgeons, neurological consults. Now, they do not have the capability to do like type surgeries and things like that for the neuro doctors, but they have a full running maternity area and a special neonatal care that is ran by Children's Hospital. For the governance structure, over all of Ohio Health, they have a president and a chief executive officer, and then there's a whole line of corporate leaders and a board of directors. And then going down to Dublin Methodist, there is a president that covers Dublin Methodist Hospital and Grady Memorial Hospital. Those are both two smaller hospitals within Ohio Health, and so there's only the one president and one chief operating officer for the two of those hospitals. A lot of the directors that come next, they also are a director for Dublin Methodist and Grady Memorial. For example, the director of the radiology department covers Dublin Methodist and Grady for all of the radiology employees. And then the managers, they are separate for each hospital, so they're not trying to go back and forth, and they have enough employees under them at each hospital that they don't have to go to both campuses. And under managers, most departments have team leaders that really keep a closer eye on the employees, and it's someone that's easier for the employees to go to. The key strategic factors that I picked out is strengths would be the quality of care and hospital culture. The hospital is really well known for the care that they give, and especially the quality of the building and just the entire stay that patients have there is usually wonderful, and they get really high ratings in those areas for patient satisfaction scores. A problem that they're running into right now is lack of space to grow. With the population growing so quickly, the hospital doesn't have room to grow also, and they're an opportunity. They're currently trying to build onto the hospital. In Dublin, there are a lot of permits, and it's really difficult to get things going. So that's something that'll take a lot of time to happen, but really needs to happen for the hospital. And then threats, again, are other healthcare facilities. Alternatives and implementation, I chose the horizontal growth. They need to grow in the services that are offered. For example, we have a cath lab there, but it doesn't run to full capacity like it does at some of the larger hospitals. They just do some outpatient services, but if someone would come in with an emergency, they would not be able to treat them. They would have to go to be sent to another hospital. And that would really help the hospital become more competitive. And the higher up management needs to become more involved. Dublin Methodist is getting so large that the directors and the president that shares the two different hospitals, I believe that they need someone that is just for Dublin now because of the growth that it's having. For evaluation and control, the hospital needs to go from the 114 beds that it currently has to at least 134. I believe that was a reasonable jump to try to do at first. And expanding the hospital would allow more office space, which would help the hospital expand and run smoothly. And the hospital needs to continue to operate at or above the expectations. All the departments are expected to run at 100% productivity and score at least 90% or above on all patient satisfaction scores. And those are my resources. Does anyone have any questions?
Lisa, I have a question. You mentioned that the directors are in charge of two different locations, and that it sounds like this facility is growing pretty big. How do you think that each facility would benefit if they had their own director?
I think that Dublin Methodist would really benefit from it. They would be able to communicate with the director more, and the director would be able to focus each department into the right direction of growing. And when a new employee is being added, the director has to approve that, and sometimes that is a really lengthy process. And with the hospital growing, they're adding more and more employees, and so until a director approves it, they're running short-staffed. And it would make the process run a lot smoother if it was an individual director just for that hospital instead of sharing with another campus that's 45 minutes away.
I definitely agree with that comment, and I thank you for your presentation.
All right, I don't remember who was next.
I'm next. Okay, this is my strategic audit, and my name is Katrina Rosgray Bell. And the organization and the healthcare provider that helped me, I did my presentation on Landstuhl Regional Medical Center. I will often refer to it as LRMC, and is basically a hospital that's part of the military healthcare system. It is about 64 years old. It was founded in 1953, and it is the largest American hospital outside the United States. It has a staff of about 2,000 with 150 physicians, 250 nurses, and the other staffs are like techs and support staff. Their mission is to provide patient-centered, evidence-based healthcare while maintaining a trained and ready force. They also serve as a combat support facility. So during times of contingencies or war, they are responsible for the coordination and movement and treatment of all injured U.S. service members, civilians, and coalition forces throughout Europe, Iraq, Afghanistan, and Africa. The healthcare professional that I interviewed was Master Sergeant Delon Betsy. Although she is Air Force, this is an Army hospital because the hospital is like a joint service. She is the superintendent of the emergency room where she plans, directs, and leads clinical operations for their level 3 trauma center. And she's also responsible for supervising 80 joint staff, which are military and civilian. Here's the corporate structure of LRMC. First, you have the medical group commander, and he is basically the catalyst for everything. He runs everything maybe like a CEO would, because they don't have any CEOs. They don't have a president. They don't even have board of directors, but the executive staff kind of acts like the board of directors. They are the ones who are subject matter experts, and they are advising the medical group commander with the chief of medical staff. So he has a doctor right there if he has any questions. He has an administrator, the chief nurse, the command judge advocate. He is basically the legal authority. So any legal issues or ethical issues, he would advise the commander. And then they also have a command sergeant major, and he's there to help with any enlisted issues for all the enlisted folks. They have 3 squadrons, and those squadrons will be ran by the squadron commander. So we can look at those as the top 3 managements. Each squadron commander has their own flight, their own elements, and other departments. The support squadron, he's basically responsible for running all the clinical, medical, logistics, and pharmacy, while the operation commander, he's more of like organizing and operating and evaluating the healthcare system. And then the dental commander, he just runs the dental department. So when I conducted my external environment analysis, I found that they're having some natural physical environment issues. They're having a reduction of land. Currently, right now, they are building up the base and outside of the base. So they're having some issues also with their water quality, which they have gotten under control. But for the past 2 years, because their water is supplied underground and with all the construction, they were having some water quality issues. The societal environment was the growth in population. Not only is the German population growing, but there are a lot of people who are at the base or also that were working at the medical facility who are now retiring and are staying in the local area. Another one is the stability of the federal government. Although the medical group commander runs the organization, he is under the direction of the Department of Defense and the President of the United States. So sometimes when they have different rules, regulations, and policies that comes down, his hands are tied. And looking at the task environment, with the budgeting how it is and with cost of fuel rising, they're having issues getting medical supplies, and also with their shareholders. As I mentioned before, I would look at the president as a shareholder, the Department of the Defense, the Army, the United States, the American people, and they also have shareholders as far as beneficiaries of the healthcare service, not only active duty, but retirees and family members. Next, scanning the internal environment, we look at the corporate structure. Their structure is set up as a divisional structure with functional areas. So just like I showed you in a previous slide, you have the commander at the top, then he has his advisors, which is the executive staffs, and to go on further, then you have your squadron commander, then you have your commanders of the flight, and then you have like element leaders. They all have different functional areas. One issue with the corporate structure is that it's very big on hierarchy. So sometimes it slows the process down when you need definite answers and you need things to get done, because some areas have to go all the way up to the medical group commander and come all the way back down with an answer, and that's running at least about 90 days. For their corporate culture is very intense and integrated, and sometimes I joke around and saying that they don't have any other choice. If you are an outlier, they get rid of you, whether you are a civilian or whether you're a military. Basically, they're integrated because they don't have any choice. They have to be. And then their corporate resources, one of them was medical staff. The capabilities that they have for their medical staff and the versatility that they have for their medical staff, most of their officers who have came into the military, they had their own practices on the outside. We have some of the most renowned surgeons who have actually converted from civilian and came over and been active duty. And so that's another thing with the capability. Not only do they have the capability to support during non-contingency times, but the big hospital that I showed you before, LMRC, they can even get even bigger with setting up Alaskan tents in the midst of a disaster. And also their location supports their mission. Them being centralized in Germany with NATO friendly forces, it really helps their mission. When I conducted a SWOT analysis, I found that they had a lot of strengths and a lot of opportunities. The one that I really focused on for their strengths was their management and their adaptability and their new facility. Right now, their facility is 64 years old. So by them getting a new facility, they will be able to expand their capabilities. For their opportunities, the one that I really focused on the most was increasing access for the non-service members. In prior slides, I said that the population was growing, so they're having to send some people off base to get care from German physicians, and they're not getting the desired outcomes that they need. One of their biggest weaknesses that I focused on was their manning levels. Due to funding cuts, and although they're fully funded as far as any programs and stuff they have, the government has pulled back on manning. So they're having to do more work with less people, and that's one of their major weaknesses. Because of this weakness, they had a problem with their delinquent medical service accounts, and they didn't collect like 1.8 million in funds that was due to the hospital due to the administrative support error because they are short. And one of their biggest threats are global conflicts, because at any time they have to readjust their mission if there is a global conflict, and also adverse government policies and funding, because there's nothing that they can do. Their hands is tied. They have to adapt no matter what because they have a no-fail mission. So here for the strategic alternative, what I did was I took their different strategies and I tried to find the common denominator of what kept coming up. And what kept coming up was manning. no matter what, one of their strengths is that their new facility. But even for their new facility, for it to really be a strength, they need manning. One of their weaknesses was that their manning level. So even to take advantage of the opportunity, they need, manning. Even if they needed to use their strengths to overcome threats, they needed manning. So that was one of the common denominators that I found for the strategic alternatives. And with that being said, my recommend strategy was for them to redefine their human resource strategy. Right now, they have two different offices. One office is the G1 personnel, which they handle everything dealing with hospital staff, and then they have a resource management. They deal with all other assets and all managing all other resources. So right now, I want them to, if they were to redefine this human resource strategy, it would address manpower. They will be better at action planning. They can improve total quality management, and they also can streamline their internal resources. For their implementation, I would like for the medical group leadership, which is the squadron commander and maybe even the executive staff or the hospital commander, to redefine the role and the structure of these two offices and combine them together. They will also need to appoint managers and functional experts. They do have talent within the organization right now in those two offices. They just need to find out who that talent is and put them to the forefront, so that way they can get the medical group running back on track and they can establish program priorities. Once the new department is combined and established, they really need to focus on staff utilization program. They need to find out where the imbalances are and correct those across the hospital, so that way they can get all the programs running back smoothly and they won't have any more costly errors. And then I also suggested for the implementation is that they also establish an organizational improvement office and try to see if they can either get a congressional review to hire new staff, or if they can go out in the local military community and hire retirees that can become staff. For evaluation and control, they already have a resource management planning system, and they can add additional features to that planning system. So I would like them to add electronic manpower. That way you can track the imbalances, you can see who's retiring, who's coming inbound, and you can better manage the manpower around the facility. Right now, they're using paper records, and I just don't think that works. I think they need to go to an electronic system, because inside of the resource management, it actually can help them improve performance. And actually, when their manning is getting low in one area, the system can actually email and let somebody know that this is a priority and you need to take a look at the statistic. They can also use their other information systems, at their electronic health records and also internal and external hospital surveys, to improve with their organizational management. And that is all. If there are any questions.
This is Leisha. When talking about the structure of how the organization is managed and everything, it doesn't have a board of directors to help manage. Do you feel like the people that are head of the organization are overwhelmed with too much work and could use a board of directors to help with the decision making?
No, I feel like the executive staff, although they do advise the commander, they also advise the squadron commander. But the squadron commanders also do have support staff in their flights. So let's say that the medical operations squadron, under him, he would have a flight commander and a superintendent to help him, manage his whole squadron. And the same for the other one. So I feel like a board of directors will only clog the hierarchy, because it's already crazy with who's in charge of what and what division, and okay, I'm going to make this decision, but I have to go ahead of me to see if that's okay if I made that decision, and that person has to go over top of someone else's head, and it just really slows the whole entire process down.
Okay, thank you. It was really interesting hearing about this different kind of organization.
I have a question.
Okay.
Since it's such a big organization and like they go through a lot of things, this is more like a personal question. Do you think social media or like something along those lines will help this company? Because I feel like with all that the work that they have to do, is there any way for them to kind of branch away from the government, or is it so strict that whatever the government like implements, they have to go with that program?
No, whatever the government implements, they have to go with that program because Landstuhl Regional Medical Center, they're actually a military, in part of the military healthcare system, they're actually a military treatment facility. So everyone that's made up there is basically about, I'll say about 85% military. So whatever comes down, they don't have any choice. They have a little bit of strategic leadway, but they basically have to do whatever the government tells them to do. One thing that is going to help them is that once they move into their new facility, and I think the government spent like $90 million building this new facility they're supposed to move in 2020, their whole organization will be looked at again, and then the Department of Defense will restructure it and re-give them money and everything. So they're hoping that they'll be in a better predicament in 2020 when they move.
Oh, okay. Thank you.
Hi, Katrina. This is Sarah. That was very interesting. I'm not familiar with this type of organization. For their funding, is it all government based? Do they get grants? How does, because it seems very large and obviously very populated, with the hopes of growing. I just was curious about where their finances come from and how that's managed.
The majority of their funding also comes under the Department of Defense, but they can make money through reimbursement. So when I spoke of them having administrative shortages and them not collecting like $1.8 million in claims, that money that they collect back for reimbursements, that's under the medical group commander. He can kind of, use that money to do what he sees fit for the organization. But like going back with the executive staff and everybody else, they don't get any bonuses for performance. There's no, what else do I want to say? There's no stock options or anything like that. Whatever the Department of Defense gives them, that's what they have. And that's the reason why I said one of their strengths is adapting. Because if you really are short like 20 doctors, guess what? You're active duty and you have to just stay there until the work is done. I mean, there's nothing more really that you can do. They can't have anybody like a civilian company come bail them out. Their hands are tied.
Great. Thank you very much. That was very interesting.
Right. I'm going to pass it over to John.
Thank you. So I just go to the share screen and then pick mine out. I'm having trouble pulling mine up. Can somebody explain how you do it again? I'm sorry.
If you see where it has the little computer, and then if you share yours, there you go.
Okay, I see it. Okay. Okay, I did my strategic audit on the Kettering Medical Center. I don't know what happened. Let's see. Okay. Okay, can anybody see my screen?
Yeah, does it at the top of the screen, does it say actual screen size for you? Oh, there it came up.
Okay, so you can see it now?
Yeah, I can see it on my screen.
Okay, I'll go ahead and start. I did mine on the Kettering Medical Center, and they're located in Kettering, Ohio, which is about 25 minutes away from Dayton, Ohio. And the person that I interviewed, her name is Chelsea Mule, and she's a director of business there. And I also use my personal manager. He's an operational manager at United Healthcare. And just a little bit of history about Kettering. It was founded in 1964 in Kettering, Ohio. It employs over 7 hospitals in the Southwest Ohio region. Give me 1 second. Okay. Can anybody still see my screen?
I cannot.
I can't either.
Do you see the computer at the bottom with the arrow pointing through it that says share content?
Yeah.
Click that.
Okay.
And then scroll down to where it says manage content.
Okay.
And then you should be able to find your there.
Okay. Because when I click on it, it says share screen. That's it.
When you find yours, it says start sharing this content. So it'll have another computer screen with an arrow.
Okay, let me see if I can find that. I think it's because I have a Mac, so this is definitely new to me.
I can share it for you, and then when you're done with that screen and say next, I can click the next.
Oh, that'll be fine. Thank
Okay.
you. Appreciate it.
Yeah, just let me know when you're ready to go to the next slide.
Okay.
Do you want to start from the beginning or?
Yeah, that's fine. I can start from the beginning.
Okay.
Okay, still loading up. Okay, I did my strategic audit on Kettering Medical Center. Next. The person I interviewed, her name is Chelsea Emile, and she's the director of business at the hospital. And I also got some information from my manager, Robert Hatfield at United Healthcare as well. Next. One of the history about the hospital, it was founded in 1964 in Kettering, Ohio, which is about 15-20 minutes away from Dayton, Ohio. It employs over 10,000 people, and it has 7 hospitals in the Southwest Ohio region. Next. Some of the strengths that the hospital has is patient care, marketing, positioning, and history. In regards to the strengths, it was voted as one of the top healthcare providers in the nation in their little field in regards to the quality of healthcare. And in several reviews in the Ohio healthcare articles, they've also rated Kettering Health Network one of the top health networks in the state as well. In the market positioning, their competitors are the primary healthcare in Dayton, Ohio. And what's good about their program is they received funds to continue to grow, and at the rate that they're growing, the hospitals and the little clinics, it continues to build and help the morale of the local area, because there was an issue in the area with the growth that there wasn't enough healthcare hospitals and things of that nature to help these people who are in need, and they needed more networks and more clinics to provide care for these people in the area. And then the history is that they've been around for a very long time, over 50 years. And Kettering, there's a kind of a history of the name Kettering, where he was an inventor, and he invented things such as cash registers and air conditionings and things of that nature. So he's had a very strong relationship and connection with the area. So that's one of the reasons why he has been standing strong for so long. Next. Some of the weaknesses that I found when I was discussing it with Chelsea, is that they don't have enough, like I was saying, they don't have enough primary care providers in the area. For years, specialists have gone way too far in alignment with hospitals, but it realizes that the primary care physicians need managers for their patients. So one thing they're trying to promote in the area is to continue to build that up and continue to implement the primary care providers in the area. And another issue that she had discussed is that the hospital looks at the prevention of, what's my train of thought? They spend more time on the tertiary level because they have 3 levels that you look in healthcare. And she gave me an example of, let's say somebody has lung cancer in America. The primary prevention would be to educate the public on the reasons that you shouldn't smoke and things of that nature. And the secondary prevention would be like screening individuals and getting checkups. But she has noticed that in at her network, they focus on the tertiary prevention, which is how to treat the patient after they've developed a certain sickness or cancer. And that's one of the problems that she's seen as an issue, because they spend more time at the hospital since they're already diagnosed with the symptom already. So this will help. If they try to implement it from the beginning, it will help lower the cost, because the cost of healthcare, we all know, is already crazy as it is anyway. But the problem is that the Affordable Care Act doesn't include financial incentives for health promotion. So that's kind of an issue and a weakness within the organization as well. Next, please. And some of the opportunities that she discussed with me for Kettering was they can continue to expand on the information technology that they have, such as the EHR and then the remote patient monitoring. It also gives them a quicker, a quicker way to see what's going on within the patients, and also is a quicker response and is a better satisfaction for the patients and the doctors in the area. She explained that one of the issues that she's seen within the hospital that is steadily getting better is the technology is advancing a lot rapidly, more than like in the past 10 years. She's seen a lot of changes in the satisfaction and just technological ways that it can help with the hospital and continue to, the patient satisfaction can continue to increase at the hospital. Next, please. And for the organizational structure, the president of Kettering, his name is Fred Monchor, and he's been there for, she said, about 8 years now. And then the external and internal stockholders, it shows right there, are the internal ones are the employees, the manager, and the owners. And then the external ones are the government, shareholders, customers, suppliers, and things of that nature. Next. One of the things that we discussed, so we did all ours over the phone, and I went to visit there one time, so it was kind of interesting to see it firsthand. But one of the things that she was going through, one of her projects that she's working on was the services that the hospital provides, such as accounting, payroll, and accounts payable. And along with the patient billing, they provide technology, medical records, and a supply chain that helps to continue to help the hospital continue growing. And that's one of the things that she wanted to take a closer look at to make sure that the numbers and everything is going correctly, because due to the growth of the population in that area, the company has bought a lot of land to build little hospitals and little clinics. And her personal preference is she feels like it will get to a point where they'll have too much of it, and then to cover the costs and things of that nature, it will kind of be an issue. So that's one of the things that she discussed with me that may become a problem later. Next. And the overall assessment I got from interviewing her and for the hospital is that right now they're at a good place. but she feels with the changes in healthcare and the cost of healthcare will affect kind of the business side of how the hospital is run, and they need to find different ways to continue to help fund this hospital and continue to help this hospital grow and continue to retain the respect that they've had in the area. Next. Yeah, like I always said, that one of the improvements would be to continue to put patient satisfaction number one and continue to just make sure that everybody's on board. She said like the leadership at the Kettering is very strong. They have regular meetings and conduct like roundabouts and checkups within the little hospitals in the area. So the communication from the top, she said, is very strong, and as long as that continues, the hospital will be in good standing. Next, please. I kind of did this differently, but one of the things I wish I would have done more was take more time to really go in deep about like what they actually do and how everything is implemented. Since it was a long distance, I met her once for like 45 minutes, so everything else was over the phone and through text, so I didn't get the first-hand experience that I would like. But I feel like if I would have did something that was closer to my area, that would definitely help out a lot. I think that's it. Does anybody have any questions for me?
Thank you very much for sharing. I have a question. You mentioned that a weakness identified was the lack of primary care doctors. Do you think the organization is losing money due to the overuse of the specialists, and how do you think that can be fixed?
She said that they are losing money, and kind of what they've kind of discussed as a company to go over that. They haven't really had any like definite answer, but they're trying to find ways to like incentives, like I said in the presentation, try to find incentives to kind of help that, because there's so many specialists within that organization that it's kind of hard, especially with all the hospitals that they're trying to build and the land that they purchase. It's going to make it even harder to get that. So they don't have really any concrete way to fix that, but they're trying to go through different avenues. So she couldn't really give me an exact answer about that, but it's something that's definitely being looked at within the organization.
Great. Thank you very much for sharing.
Hi, John, it's Katrina. I have a question. So with patients using specialists instead of using primary care physicians because there's a shortage, has that impacted their patient satisfaction? Because I know if I want to see my primary care doctor, I want to establish a relationship and have continuity. But if I'm seeing whatever specialist is available, that's going to impact how I feel about the organization.
Yeah, that's a good question. She when we discussed it, that's something I kind of asked her too, and she said that it's taken a hit, but not as much as you would think, because it's such a small area, like where the hospital is. It's not like Columbus where we have so many other options, so they kind of don't have a choice. But she said it has definitely taken a hit, and they're trying to figure out why it's so difficult to get primary care, because according to what she was telling me, like the pay is competitive enough where people will come, but since I feel like there's so many different networks and different health clinics, especially in Columbus, so I don't see why it would be a difficult thing. But since it's a small city, that's why she said that's one of the reasons why. But I still think there's something else to it, because I don't personally think that it should be that difficult to have a shortage of that magnitude. But I'm not sure.
I think it might be with that new hospital that opened up in Beaver Creek over there by Fairfield, and I think that they really did cut into Kettering's market share. I can say that because their facility is really state of the art.
Yeah, I've seen that. I've seen their facility, and their facility is not, it's not bad at all.
Okay, any final questions, comments, or concerns for anyone?
I think it went pretty well.
Okay, that concludes the presentation, and I will